So welcome to my culminating presentation. I completed my practicum at Community Root Support Services, which is an organization that offers support services as well as counseling and home share and independent living programs. So I just want to start my presentation with a territory acknowledgement. I think it's important to discuss my own positionality here. I'm a cisgender white settler on the unceded lands of the Lekwungen and Wasanich peoples. I am a person with disabilities, with a focus in disabilities. Just good to be open about positionality. So just to start out, here are a few of the tasks that I completed and worked on while at Community Roots. So support work, just working with clients, supporting them with their goals, program planning, which was my practice scenario, but just creating a program called Roots Groups, creating a resource manual, which was just a way for clients and staff to find resources like transit passes and all that kind of stuff. So just getting into my practice scenario, which was program planning. We created a program called Roots Groups, which honestly, name credit to my supervisor. It's a really catchy little name for Community Roots. Many clients just really voiced a repeated want and way to connect with others while at the same time just engaging in meaningful activity. So we need to understand what their interests are and areas they wanted support or skills they wanted to develop through activities. So from that, we created a full schedule, sourced locations for these activities, allocated resources to certain activities. And this required using PHSB skills like program planning, which we did, interprofessional teamwork, and just in general, across the board, cultural safety and competency. So just zooming in a little bit on my 3 skills that I carried forward, it was looking at old projects of program planning and just assessing the needs of the community and finding those resources in terms of interprofessional teamwork, working with team members in a respectful and meaningful way, being able to edit and modify ideas for the program in a respectful and positive manner, just working closely with one another. And then for cultural safety and competency, just listening to clients and respecting their boundaries. Because Community Roots works with a really, really big, diverse body of people, it's important to discuss and listen to the ways people want to receive care, especially because Eurocentric approaches to care are often dominant in a lot of settings and differ. So just making sure to understand how the clients want to receive care and have staff work alongside them, their community, and their family outside of a Eurocentric health lens was crucial to providing services in a way that felt comfortable for everyone. Another huge factor of my practicum was interdisciplinary work. A lot of clients receive care from various support workers and community resources. So in many scenarios, Community Roots has needed to collaborate and meet with outside community resources to support a client. And then from that kind of stems into community-based approaches to knowledge and development. By creating programs in around the community, participants will be able to develop knowledge and skills alongside one another and connect with different organizations, just promoting outreach and opportunities of their own, which I think is fun. So the 3 knowledge areas, I think, played a huge role when creating the program. Determinants of health, they come in many forms and affect everyone in various ways. And each client had their own personal barriers with determinants of health. And for many, this included employment, physical environment, social supports. So just having support workers do their best to work with clients and navigate these barriers. Similarly, harm reduction alongside the determinants of health is harm reduction, just because a lot of these determinants intersect with drug use. So often support work has to function as harm reduction just to understand everyone's needs. And then lastly, multidisciplinary teamwork. Again, I mentioned this before, just there's a reoccurring area of knowledge as every client had a team of multiple support workers and organizations working along them. And then this is my call to action. You guys can read it if you'd like. It's aimed at medical and nursing schools, but I think it's really applicable to the PHSB program. I'm planning to take courses outside to further my knowledge on Indigenous health and history. I would like to continue to take courses on cultural safety and Indigenous health. I'm able to do this both within and outside of school. So just continuing to grow with my own cultural humility and acknowledging my own biases and knowledge gap. Something I thought was interesting was a lot of the program has focused on working with Indigenous people in a healthcare setting, mainly as like patients or clients, but not often as peers or leaders in healthcare settings. So moving forward, I'd like to continue to work and learn alongside my Indigenous peers in healthcare settings and just continue to decolonize my view. And then lastly, these are my little key insights, just working on my interpersonal skills. What I do differently is I have rough time management. So just working on my organizational skills, and I'm just proud of the relationships I was able to create with the members of my community at CRSS and working with my clients. So a big thank you to all these people and everyone in the program. It's really cool that we're all done. And yeah, that's my whole program or presentation. Thank you.